Good morning, class. So today we're going to be looking at the different methods we can use to locate acupuncture points. And the techniques we learn today are very important as you'll be using them throughout your practical lessons, as these same methods we use to locate all the points you'll be learning about. So next, let's move into the introduction. So before we start with any palpating, the first things you need to remember is that you should always stand on the right-hand side of your patient. And this is for two reasons. Firstly, it makes the patient more comfortable if you're on their right-hand side. And secondly, this is the standard procedure for all medical professionals. Secondly, I want you to make sure that your patient is lying in the correct position before you start palpating any points. So think about what points you want to palpate and what position you need your patient to be in before you even start palpating, as it is not professional to be moving your patient around constantly throughout your palpation. So if you're going to do points in the back, you would want your patient in the prone position. Whereas if you're wanting to do points on the front side or the front side of the legs, then the patient would be in the supine position. And thirdly, we do minimal palpation on the chest and pubic region. And this is especially important in patients of the opposite sex to the practitioner. The fourth point is that you should always be professional, even during your practical sessions. Treat your fellow students as you would a patient, as I do not want you to develop bad habits that you carry through to when you are treating your own patients. And then the final point is that even though you may be in larger groups, try and palpate every single point for yourself, as the points sometimes sound very easy to locate when I explain them, but they often prove to be much more difficult when you try and do it yourself. So make sure that you can locate them correctly. And after you have located the point, remember to mark it on the patient and then try and get either your fellow classmates or one of the supervisors to check that you have located the point correctly. Now we will look at how we locate points. So there are four main methods that we use. The first method is anatomical landmarks. The second method is known as proportional bone or body measurements. The third method is known as simple ways of locating points. And then the fourth and final method is the FINGER-CUN measurements. So firstly, anatomical landmarks. So this is the most accurate way to find points, as most anatomical landmarks are standard throughout all different patients, and they will not change with movements. There are two main types of anatomical landmarks that we use. Firstly, the fixed landmarks. These are landmarks that will not change no matter what position the patient is in. These are body parts such as the nails, the umbilicus, the bony prominences, and muscles. One such example is stomach 25. As you can see in the image here on the bottom left, this point is located 2 tsün lateral to the umbilicus. So you'd locate the patient's umbilicus and then you'd go 2 tsün lateral. Or a point such as GB34, which is located anterior and inferior to the head of the fibula. And then secondly, moving landmarks. So these are spaces, depressions, or creases which appear with certain movements. And a good example of this is found in your wrist crease or elbow crease. Some of these creases can only be found when you either flex or extend the hand. So if we look at the examples, large intestine 5, this is the picture on the bottom right over here. Now this point is located in the center of the anatomical snuff box. And the anatomical snuff box, if you look at this image here, is the little depression that is formed between the two tendons of the thumb. This tendon over here and here. So when the patient flexes the thumb, these tendons become more prominent and the depression becomes prominent as well. And this point is located in the center of it. Or another example is Sanjiao 21, Ermen. This point is located on the ear, and this point is found by asking the patient to open the mouth, and this causes the condyloid process of the mandible to slide forward, creating a depression, and this point is located in that depression. The second method is known as the proportional bone measurements. So what this refers to is that we get standard lengths for different parts of the body. So for instance, if you look here on the image on the right, from the elbow crease to the wrist crease, And what it does is measuring the length of the forearm, and it's measured at 12 tsun. The interesting thing here to note is that the 12 tsun is not like normal measurements like centimeters or meters or inches, where it's standard no matter what you're measuring. When we use the tsun measurement in this form, the 12 tsun is actually a relative measurement. So what that means is that 12 tsun on me will be different to 12 tsun on someone else. This is all relative to your own body proportions. And that's why we have to use these two wrist creases, because the measurement will vary from patient to patient. So you'll get their standard by using these anatomical landmarks. And then this method is the second most accurate. It's almost as accurate as landmarks. We consider it not as accurate, as the practitioner can make more errors when locating points in this way. As if the practitioner did not locate the wrist creases correctly, then their 12 tsun would be slightly too small. And then you might be also wondering, what is a tsun? This is a measurement similar to millimeters or centimeters, but it comes from China. And like I said earlier, when we use tsun in this case on body measurements, is relative to each person. This is different to the tsun we learned about with needling technique, as that is a standard size tsun. That one tsun there will always be 25 millimeters. And one tsun on the body proportions will not always be 25 millimeters. So this next slide shows a table of the proportional bone measurements. So what the function of this table is that it can be used for revision on how to determine the different measurements. So if we look here on the left, this is the body part that we are measuring. So the head, chest, abdomen, back. And then the location tells you from where to where you have to measure. So if we can bring in the image from the previous slide here on the left. So if we take the first one, for example, which is on the head, it says from the anterior to the posterior headline. So if you look here at this image here, this is the one we're referring to. So it says from the anterior, so this is the anterior hairline over here, and to the posterior hairline over here, and that measurement is 12 tsun. What it means by longitudinal is it's a lengthway measurement instead of the transverse measurements will be from left to right. We can also do another one as an example. So if we look at this one over here on the chest, this one says from the sternocostal angle to the umbilicus is 8 tsun. So from the sternocostal angle, this is the sternocostal angle here on the image, to the umbilicus is 8 tsun. So this is just so that you know which two markers to use when you're locating the different lengths. And what we will do is during the practical session, we'll go through this in much more detail and give you a chance to try and use these different measurements. But what I want you to do for now is to know from where to where and then the length, as this is very important. And what will happen is when we move on to the individual meridians, you will need to know these distances in order to locate points. For instance, when we're locating points here on the forearm, between this region here on the image, sometimes a point will be, for instance, 4 tsun proximal to the wrist crease. So that means 4 tsun inwards from here. And the only way you can locate 4 tsun is that you have to know that from the wrist crease over here to the elbow crease over here is 12 tsun. So we're going to go 1/3 of this distance like this. And then you'll know the point is over here. So without that knowledge of the distance being 12 tsun, you won't be able to locate this point. And that's why it is so important to know these different measurements. Okay, and then there's measurements for all sorts of parts of the body. You can see here's the head measurements, there's chest and abdomen measurements, and then there's measurements on the back. And then if I just show you one transverse measurement, so if we look at the image again, and we look at this over here, the distance between the two frontal angles, or the angles of the hairline, is 9 tsun. That is referring to the distance between the angle here, this angle, and this angle here, and that's 9 tsun. So you can see this is going from the left to the right side, and that's why it's a transverse measurement, not a longitudinal measurement. And then this table continues in the same way. It's showing you the rest of the points for the lateral chest, the upper extremities, the lower extremities, and then down to the foot. One key thing I want you to remember here is that when you're using these measurements, as you can see, we sometimes give different measurements for the medial and lateral side. That is especially important on the legs, as the medial malleolus over here and the lateral malleolus are not level. So you cannot use the same measurement on the inside and the outside of the leg. And that's why we give you two different measurements here. But on the forearm, because it's using the creases, we can use the same measurement for the medial or the lateral aspects. Next, we're going to look at the simple ways of locating points. So this method involves using easy or simple methods that were developed to help make it easier to locate points. So what will happen is when we go through the individual points, we will talk about the points which have simple ways of locating them. But two examples that we'll talk about now. So one such example is lung 7. And if you look at the image, you can see that we use a special method when we locate this point. What we do is we interlace the webbing of the thumb and the index finger with that of the patient's. And then where the index finger lands is where the point is located. But we'll go into more detail on exactly how we use this method when we get to this point. Another example is GB31, Feng Shi, and how we locate this point is we ask the patient to let their hands fall down to their sides, and wherever the tip of the middle finger lands on the leg, that is GB31. So the final measurement technique we will use is known as the FINGER-CUN measurements. So what this technique involves is using different parts of the hands to get estimates of different CUN measurements. So the first way we can do this is using the middle finger measurement. This involves using the medial ends of the creases of the middle finger. So that's referring to this part of the finger here and here, and the distance between these 2 points is measured at 1 CUN. And what you need to do to emphasize the creases is to flex the middle finger, like this image over here. And then the second method is known as the thumb measurement, which is the measurement of the width of the thumb at the interphalangeal joint. So this is the interphalangeal joint here, this part of the thumb, and we measure the width from the medial to the lateral end as 1 CUN as well. And then the final method we can use is known as the four-finger method, and this measures the width of your 4 fingers, also at the proximal interphalangeal joint, this part here, and the measurement from the ulnar end of the little finger to the radial end of the index finger is measured as 3 CUN. And we usually only use these measurements as a supplementary to our other methods of measurements, as these measurements are not always the most accurate. There's 2 reasons for this. Firstly, these measurements are actually based on the hand of the patient, and your thumb might not be as big or bigger than the patient's thumb, and therefore this would slightly change the measurements. And secondly, it may be possible that in one patient, the measurement of 1 CUN on their arm may be different to the same 1 CUN measurement on their legs, and then that would make this method inaccurate. And you can also test this yourself by taking any one of these 3 methods and then trying to measure the different parts of your body. For instance, we already said that the distance from the cubital crease of the elbow and the wrist crease is 12 CUN. If you could measure the same distance as 12 CUN using the thumb, and this measurement should be 12 thumb widths. And if you use these measurements on a few different parts of the body, what you'll notice is that sometimes it is accurate and sometimes it isn't. And when we're trying to locate points, what we're trying to do is we're trying to be as accurate as possible, as often as possible. And therefore, that's why we don't like these methods to use as often. We only use this method if it is not possible to use the other 3 methods mentioned earlier. And that is the end of our lecture on locating acupuncture points.